We are back. We ran out of battery juice, so we have a new battery in and we're good. Okay, so where we left off, the most recent study was the research that showed that there's been excessive force to the anterior longitudinal ligament with excessive extension. So this illustrates that the cervical spine is more likely to suffer injuries from extension pattern versus the flexion pattern. The segments that experience the maximum stress and the largest degree of segmental angulation under a rear end impact were the lower cervical spine. So segments particularly C6 and 7 and C7 and T1. Other structures that displayed signs of stress due to whiplash were the posterior longitudinal ligament at segments C6 and 7, and the ligamentum flavum at segments C2 and C3, and the intertransverse ligament at C3, C4. The major ligament that was affected by the whiplash injury was the anterior longitudinal ligament, and injuries to the anterior longitudinal ligament have a high correlation for cervical instability, especially in the extension, axial rotation, and lateral side bending directions. Due to this close proximity of the ALL, which is the anterior longitudinal ligament, the anterior annulus fibers of the intervertebral disc can experience early degeneration with an added hypermobility to the cervical spine. As degeneration of the disc occurs, cervical stability becomes even more imperative because of the excessive shearing at the disc of the segment that is hypermobile. The spine will begin to kind of close off in the intervertebral foramen and therefore start stressing the facet joints more and also increasing the risk of osteoarthritis in the cervical spine. So with the research mentioned above, there are a number of anatomical changes that occur with the whiplash injury and that affect both soft tissue as well as the cervical spine. Muscles that support the cervical spine can shut down and cease to work either due to excessive strain or the nerves that innervate the muscles, causing muscles to stop working efficiently enough to perform normal tasks. The deep neck flexor muscle, longus coli as well as longus capitis, has been proven to have a role in extra support in the cervical segments, as well as helping to maintain the natural curvature of the spine. The primary focus of the multifidus is segmental stabilization. Located on the posterior side of the spine, straining these muscles or injury to the nerves of these muscles can shut down the physiological responsibilities that this muscle has on the cervical spine. So the three physical entities that make up integrity of any joint is the overall structure, the physical structure of the joint, the ligaments, as well as the muscles crossing over the ligaments. Seeing how whiplash creates compromise to the structure, which is the disc in this case, the muscles, the longus capitis and longus coli and the multifidus, as well as the ligaments, the anterior longitudinal ligament, it is safe to say that people who have suffered a whiplash injury will not be able to support their cervical spine as efficiently as before. The added segmental hypermobility will eventually give way to the long-term instability of the cervical spine, which may cause further mechanical deficits later in life. Other structures such as nerves can also be compromised by either the shearing of the vertebrae or the intervertebral foramen. These types of instabilities may cause compromise in the motor signals stemming from the cervical spine and depending on the segment which is hypermobile. This could either cause a slight or severe neurological symptoms to occur in various parts of the upper extremity. A reported finding shows that the activity of the serratus anterior muscle, which is right underneath the arm, can alter a patient's can be altered in cervical patients. The serratus anterior is a prime support for upward rotation of the scapula, so as you raise your arm, your shoulder blade lifts up, and is needed to complete full arm elevation. This report confirmed its hypothesis that neck pain, whether it be insidious or by whiplash, may demonstrate a pattern of altered scapular activity that will cause delayed muscle activation and decrease overall muscle activity in the serratus anterior, and in these patients compared to those in the asymptomatic group. The serratus anterior is a muscle innervated by the long thoracic nerve. The long thoracic nerve is derived from the roots of the brachial plexus, which stem from the cervical vertebrae of C5 through C7. This particular finding reflects that the neck discomfort and instability can affect the neuromuscular pattern of other limbs throughout the body. Muscle strength as well as endurance is reduced due to the increased strain and load through the cervical spine, which is blocked off of the neurological pathways traveling to the anterior serratus muscle. Another study conducted by Giddens examined 220 patients who have experienced whiplash disorders and also assessed their shoulders for subacromial impingement. And these researchers hypothesized that the subjects with whiplash-associated disorders may essentially develop an impingement syndrome. This article concluded that and validated that the neck injury and impingement syndrome are in fact associated, since the nerves that innervate the muscle of the upper extremity stem from the cervical spine. Instability in the cervical spine may also be the underlying cause for shoulder pain. And so as the external rotators are C5, the myotomes, you can imagine at that C5, if it's being messed up along the cervical spine, it's going to be sending faulty signals down to the arm. So with that being said, in conclusion, altered scapular patterns and orientation will cause the rotator cuff muscles to potentially become impinged under the acromion if the neurological signals are not being delivered effectively and efficiently to the muscles that they are innervating. Taking the time to assess cervical stability with patients that present in shoulder symptoms may determine whether the cervical spine is or is not the main factor driving the shoulder symptoms. The literature above confirms the various structural changes that occur in the neck region with a whiplash injury. Even insidious neck pain has been linked to cervical instability. Educating patients who have neck pain to engage the deep posterior neck muscles as well as the deep neck flexors on the anterior side will be beneficial to those who are trying to reestablish better cervical stability as well as overall strength in their extremities. Thank you.